COVID-19. Let's go there now.
I would now like to hand the conference over to your first speaker for today, Mr. Teddy Duchamp. Please go ahead, sir. Thank you.
Good afternoon, everybody. Thank you for hopping on the call today. Today on the call, we've got Minnesota Department of Health Commissioner Jan Malcolm, the Department of Health's Infectious Disease Director Chris Erzman, as well as Minnesota Governor Tim Walz. Just a quick reminder to all the reporters participating today, we ask that you limit yourselves just to a single question with one on-topic follow-up, just to ensure that we get to as many reporters from as many different media outlets as possible. And with that, I'll go ahead and turn it over to Minnesota Governor Tim Walz.
Thank you, Teddy. Good afternoon, Minnesota, and good afternoon to everyone on the call. We're at a critical point in our COVID-19 fight in Minnesota and in the country, quite honestly. I want to make sure I say thank you to each and every Minnesotan who sacrificed over the better part of the last 7 months, and especially to those folks who have been thrust into the front line of this, whether it be healthcare workers, childcare, teachers, folks at grocery store clerks, and so many. This is a tough fight, and during this time, we're going to quickly be approaching 250,000 Americans dead and 10 million infected. And to be very candid, with very little end in sight. With that being the case, the work that we've done has made a difference. We've slowed our infection rates. We've prepared our hospital space. We've prepared the equipment necessary to care for our neighbors. Last time I was with you, we talked about a key component, those things that people can do themselves with wearing of a mask, social distancing, stay home if you're ill. And then the piece that is a critical part of our strategy, and it's what allowed other countries and will allow Minnesota to be able to significantly make a difference in the expansion of COVID-19. It's by expanding our own testing capacity. And we talked about new opportunities for Minnesotans to get COVID-19 tests. We opened our saliva testing lab in partnership with IVX and Vault in Oakdale. And very shortly, Minnesotans will be able to take a test, get results almost immediately without leaving their home. It's a good news and a positive development. And the reason for that is testing is the key to stopping the chain of the virus spread. This past weekend on Saturday, we had the opportunity to host Dr. Deborah Birx, the White House top advisor on coronavirus, down in Rochester. And she couldn't have been clearer. The upper Midwest is at a critical juncture. Her assessment was that the state of Minnesota and potentially the state of Illinois still possess the capacity to stop what's happening in surrounding states. More highly populated states like Minnesota, Illinois, and Michigan pose an incredible risk of what could happen here. And she was clear that widespread testing, especially amongst asymptomatic people, is the key. That is the message coming from the White House, the message coming from Dr. Birx. And her assessment is Minnesota's previous investments in our ability to hold the positivity rate gives us a fighting chance here. The virus, as she states, and all of us have known now for quite some time, is most dangerous when it's infecting people who don't know they have it. I get it. People are tired of it. She stressed very clearly that younger people know that there's a pretty good chance they won't get really, really sick, although some will and some will die. That has emboldened people to feel like we can get around. We don't have to follow these things. And I am with everyone else. The desire to get back to normal and what's now being called COVID fatigue is real. But just because we want it to be over does not make it over. Just because we want to go see games and want to gather in large gatherings does not mean we can without endangering both ourselves, our family, and our neighbors. So we need to be vigilant. Her message was this to us: cases are rising across the upper Midwest, and Minnesota is no exception. So when people don't know it, that they're spreading it. According to the data, it's spreading across rural areas in greater Minnesota as quickly as anywhere else. Just to keep in mind, the infection rates in the upper Midwest, and as she stated specifically on our eastern and western borders, are the highest infection rates on the planet right now. And so everyone out there, no matter what corner of the state you're living in, whether you have been blessed enough to not have a friend, a neighbor, acquaintance, a family member infected, it is out there. So I've been saying since March that we knew we were in for a long, dark winter. We said in August that the potential for a fall comeback was great if we were not able to do certain things right. We know what we can do to slow the spread of COVID. We know what we can do, and thanks to incredible work in our hospitals, what we can do if you do get sick can help ease that infection. But we can't overwhelm our hospitals. We can't assume that the therapeutics are going to take care of it, or that we're waiting for a vaccine that will eventually come. We need to take action right now. So I'm just going to ask, between the CDC, between the White House top expert, between the Mayo Clinic, between every single health organization, avoid large gatherings. Think about those gatherings even with family that may seem safe. Wear a mask, no matter how small that gathering is, socially distance. And now one of the things we can certainly help with and continue to work on is test. And so I know there's a lot of analogies go around about this, what inning we're in, everything else with this. My analogies, my coaching in football, this is a goal line stand, Minnesota. Other states have gone up. And when a state with a population of 600,000 gets high infection rates, it's very different than a state with 6 million gets high infection rates. And so this is the next 6 to 12 weeks are going to be critical in this fight on COVID. They're also going to be critical on the number of our neighbors who get sick or we lose. So I ask us to follow that advice. We've done a lot of this work. We are as best positioned, as Dr. Birx herself said, as any state in the nation, to make a stand against this. And I'm certainly imploring that we do so. And with that, I'd like to turn it over to Minnesota Department of Health Commissioner Jan Malcolm.
Thank you, Governor. Good afternoon, everyone. Governor, I really appreciate your clarity on those messages. The conversations with Dr. Birx were really very, very valuable. And as the governor has reported, she couldn't have been more clear, both about her appreciation for the good work that's been done in Minnesota, but the fact that we're in a very vulnerable spot right now, and that time is really of the essence to double down on those prevention strategies, to try to do everything we can to lessen what are undeniably going to be a challenging number of weeks. I'm just going to give you a little bit more data, context for what the governor has said, and then ask Director Erzman to also update you a little bit. Around the world this morning, we're above 43 million cases, which, this is rather shocking, is more than 1 million new cases since we last talked on Friday, and over 1.15 million deaths, which is 10,000 more deaths worldwide just since Friday. In the United States, we're now over 8.6 million cases and over 225,000 deaths in the United States. This is really stunning numbers. And the rate of increase in the cases, as you may have noted, has now reached its highest levels ever, over 83,000 in one day over the weekend. Here in Minnesota, yesterday we had 1,578 additional cases come through the laboratory process on a testing volume of just under 23,500. That's an increase of 5,518 cases since our last call on Friday. These numbers are getting so large that you really have to stop and think about what this means. Sadly, we had 4 additional deaths among Minnesotans yesterday, 39 deaths since our last call on Friday. There have been a total of 9,588 patients hospitalized since the beginning of the pandemic. 2,558 of those have received intensive care. Yesterday, there were a total of 582 people in the hospital. Now, what's notable is we started the month of October with 343 people in the hospital. So yesterday's 582 represents a 70% increase in those requiring hospitalization just in the last month. So to the governor's point of the speed of increase here. We did report a significant number of cases over the weekend. This is our 5th consecutive day with more than 1,500 new cases a day, the 19th consecutive day of over 1,000 new cases. 2 days in October now, we've seen over 2,200 cases in one day. Our 7-day average testing positivity rate remains at 6.5%, but that is up from 5.8% just a week ago. to talk a little bit more about the trends that these individual numbers are buried within these some really stunning trends. Our case growth from mid-August to mid-September was 22%. The case growth from mid-September to mid-October was almost 4 times higher at 83%. Now, it's also interesting to note that it took us 2 months to have our first 10,000 cases. We hit 10,000 cases a week ago, and we're going higher yet. So just the speed of case growth is really something notable. And we've certainly talked in the past about the fact that part of that is because we're testing a whole lot more. We're finding a whole lot more. But as we keep reinforcing, because the case positivity rate is going up, not down, and because the rate of growth of cases is going up faster than the rate of testing, we know this is not just an artifact of testing more, but it is that there is more disease out there around our state. While the earliest phase of the pandemic played out mostly in urban areas of Minnesota, more recently, the case growth has been even more pronounced in greater Minnesota, particularly the western half of the state, where both case growth and hospitalizations are highest. Part of the challenge in these areas is proximity to neighboring states with high case growth, as the governor has mentioned. But in general, we also see higher case numbers in the areas of our state that are also reporting more resistance to following the public health guidance of avoiding large gatherings, keeping social distance, and resistance to masking. Another change over the summer was that in the early part of the summer, case growth was primarily in younger ages, specifically 15 to 24-year-olds. But more recently, since the beginning of September, the average age has increased, and more of the cases now are coming in working age adults and older. Our case growth now is being driven by community transmission, both known and unknown contacts of community outbreaks and community exposures that don't have to do with a specific large workplace outbreak or large long-term care outbreak, as was true in the beginning. This community transmission has accounted for 78% of our cases since October 1st, which makes controlling outbreaks extremely difficult. We're still seeing increases in outbreaks in so many social gatherings of all types all over the state of varying sizes, including weddings and funerals. Just as an example, and this is so sad, we've had more than 70 wedding-related outbreaks since June, which have led to more than 650 primary cases. But we also know that each primary case transmits to a number of other people. So if you just do the math, if every case transmits on average to 3 other people, after 4 transmission cycles, which would be about where we were now from early June or July, that one case has led to 71 other cases. So when we talk about the outbreaks and the primary cases, that is truly the tip of the iceberg, and how those cases spread from weddings, ceremonies, parties, all of these things just can spread beyond the immediate event. And among the participants in that event, whatever it might have been, into our workplaces, our healthcare facilities, our long-term care facilities, our schools. And again, while hospitalizations decreased between mid-August and mid-September, since mid-September they've increased 115%, with around 650 more admissions each week, 100 of these being into intensive care. And this rate of hospital increase, of course, is concerning heading into the fall, when we know there are more respiratory illnesses, more pressures on hospital capacity, and we see how quickly our neighboring states and states around the country have gone from feeling relatively good about their hospital capacity to being very, very, very constrained. Because it's not just a question of how many beds do we have. It's healthcare worker infections, which are also unfortunately rising quickly in Minnesota, leading to concerns about the ability to staff the work in hospitals and congregate care. We've talked about the fact that cases in long-term care have increased over the past month due to increased community transmission. Schools and institutes of higher education are also an area of concern. even as teachers and administrators, the Minnesota Department of Education and the Office of Higher Education have been working incredibly hard to prevent outbreaks. Nevertheless, 27% of K through 12 schools in the state have had at least one case since school started, and happily, the majority have had only a few numbers of cases. So currently, there are 33 K through 12 schools with 5 or more cases. At least 26 of these higher incidence schools include middle or high school students. And over half of all of our higher education organizations in the state have had at least one case since August 1st. And with that, I'd like to pass it to Director Ersman.
Thank you, Commissioner. I'd like to continue the conversation about the opportunity that we have at this point in the pandemic and the need to have a strong defense as we move forward. And I'd like to talk a little bit about social gatherings. While many people have focused on safety in public settings like grocery stores or gas stations, saying that they feel safe in those locations, it's worth emphasizing the point that social gatherings, small and large, are really what's contributing to this spread. All too often, we're hearing about people getting sick after attending a smaller social gathering, perhaps not realizing the risks are still there, even if you get together with a smaller group of people that you know. To be clear, there is a lower risk with smaller groups, but that doesn't mean there's no risk. At the level of transmission that we're seeing right now in the community, things that may have been relatively safe a month or two ago may no longer be safe. Given what's happening in our communities, people should be considering with caution any activity that involves close interaction with even a small number of people from outside your immediate household. Remember that fewer people means less risk, but it doesn't mean no risk. Outside means less risk, but it doesn't mean no risk. Mask means less risk, but not no risk. That's why we say the more layers of protection you build in, the better off you are. The takeaway from all these numbers that we've all shared is that Minnesota is experiencing a very high and growing level of community transmission of a disease that can cause a huge range of impacts. Those impacts range from death on one end of the spectrum to no symptoms or mild symptoms. And in between those two extremes, we are seeing many people with significant illnesses, some that include health problems that linger for weeks or even months after the initial infection. No matter who you are, young, old, healthy, or underlying conditions, you don't know what your COVID case will be like, and you shouldn't be rolling the dice that it will be mild, because too many people are losing that gamble. If you get infected, chances are you will pass that infection on to others near you, and they'll pass it on to others as well. And as the commissioner said, if we look at the averages, a single case infects 3 other people, and within 4 generations, that has an impact of 71 infections. Somewhere in the chain of transmission that you start or you keep going with your case, there will be someone who has a serious, lengthy illness or even dies. If you don't worry for yourself, worry for them. Please help protect them and Minnesota by following the basic health recommendations of wearing a mask, practicing social distancing, avoiding crowds, staying home when you're sick or when you've been exposed to someone with COVID, and getting tested when needed. Thank you. And with that, I'll turn it back to the governor.
Thank you, Director. Thank you, Commissioner. And again, a pretty stark picture being painted here, but I think we see that across most of the country, especially the upper Midwest. I will go back to, again, we have the capacity to change this trajectory. We can write a different story on what COVID-19 does in Minnesota, but it's going to take all of us. It takes every single one of us and the commitment to make that happen. So with that, I would, operator, open it up for questions.
Well, ladies and gentlemen, Q&A is now open. To ask a question, simply press *1 on your telephone keypad. And our first question is from the line of Jeremy Olson of the Star Tribune. Your line is now open.
guess a question and a follow-up. But Governor, I mean, there was a time this summer when we were feeling pretty confident, maybe even haughty about how our mitigation measures were working. The South looked so much worse than we did. And now a lot of the case growth is here. And what we've learned about this pandemic is the virus just goes where it hasn't been already. So how can we be so sure that we can paint a different picture, that what we can do is working? And you sound pretty confident that we have the ability to impact it. Do you really believe it?
I believe it if people do it. And the reason that I believe in this is other nations have done it, whether it be South Korea, Vietnam, or we've seen states that have made a difference. And I don't think it was about being cocky about it. It was about putting in sound epidemiological principles, about executing them. But I am going to say, we have no national strategy. 50 governors were left to develop their own testing strategies. We've seen great differences in how those were enforced, and that's where we're at. Now, I don't say that to be crying about spilled milk. I say it because my responsibility is to protect Minnesotans, and I'm trying to use every tool necessary. Dr. Burks, in her assessment was, we've got a fighting chance. And I'm not going to name other states that she said do not have a fighting chance, and this thing's going to burn. It's going to burn hot. I have said numerous times that before states like Arizona and Florida went up, their numbers did not look that much different than ours. I have, along with, I think, Commissioner Malcolm and Director Earsman, warned that you can go from a pretty stable situation to an out-of-control spread very, very quickly. So there's no guarantee we can do this. I do feel confident we have the strategy, we have the testing capacity. If we have the will, we can significantly slow this. And the whole thing that we've been saying all along is this false choice between keeping the economy open and public safety, that they both go hand in hand, and you have to make smart choices. So I am confident that the tools are there, but I certainly am going to need a lot of help from a lot of folks to help make that happen.
A quick follow-up question. It's been weeks, months probably on this call since someone mentioned the term R0 or RT or anything, but you just, Commissioner and Chris, you both mentioned one person being likely to spread the infection to 3 others. Is that proven? Is that the working assumption? Is that the R value? I'm just wondering if that was kind of on back of a envelope estimate, if that's the real deal.
Yeah, thanks, Jeremy. Yeah, thank you, Governor. Jeremy, I'm going to ask Chris to comment on the R0 and the RT specifically. I think the what we just both shared today, I think, were some averages of what we're seeing in recent case investigations. But Chris, can you comment on the I know the R0 and RT calculations are quite complex, and there's a whole number of different ways of coming at that.
Sure. Thank you, Commissioner. Yeah, depending on what study you look at, the R0 is anywhere from 2.4 to 4.0. So we went with 3 kind of as a middling.